Hi everybody, Dr. Vito here. Today I want to talk about numbness, tingling, lack of proper circulation into the arms. It's a common thing that some people will experience, and so I want to talk about the anatomy of where that can come from and how that relates back to the source. So when it comes to any kind of sensation in the body, there's really two things that contribute to that. One is obviously the nerves, right? You have something called mechanoreception, where if any tissue receives any kind of physical impression or sensitivity, it sends that signal back up into the brain, right? So that's mechanoreception that involves the nerves. The other way is obviously those nerves need proper blood flow to bring oxygen to them so they can do their job properly. So when we have a lack of nerve flow or blood flow, that's where we'll have numbness, tingling, or altered sensations called paresthesia. So the question is, where does that come from? Why does that happen? Okay, well, we basically have to look upstream of the numbness and look at what might be occluding or blocking free, uninterfered flow of blood or nerve impulses. So as it comes to that, we look back, and basically what you have here is, obviously this is the spine, and you have to look at where the nerves exit. Okay, so there's something called the brachial plexus, which is where the nerve roots from C4 down to T1 will branch off and go through the go through the shoulder area, the axilla, and then down into the hands. So the question is, somewhere along there, right, where is the interference? First place you want to look is the spine, because that's where the joints can very easily irritate the nerves. That's why we check when someone has any kind of numbness or tingling into the extremity. We check back to where those branch out from the spinal cord. A lot of the times in the lower neck, that is the cause. It could be from chronic misalignment, it could be from whiplash injuries, neck injuries, and things of that nature, creating problems or scar tissue over time. It's not always that though, right? It can also come from the soft tissues in the pectoral girdle. So when it comes to a lack of proper nerve flow or blood flow, that can actually come from tight muscles. So there's something called thoracic outlet syndrome, where you can have tight pectoral muscles. Sometimes you can have altered anatomy, like an enlarged transverse process or a rib on your seventh cervical vertebra. All those things will occlude proper nerve flow or blood flow into the extremity. Then, even after that, you can have issues in the rotator cuff, you can have problems in the arm, elbow, all the way down to the wrist. Some people think they have carpal tunnel syndrome, and it's a problem here, when really, in fact, it's actually stemming back from nerve interference way back in the neck there. We'll see that not uncommon, where we are able to improve their sensation into their hands or circulation into their hands and arms without ever touching their hands. Because what we really want to look at is the cause and correct the cause of the problem. So when it comes to these things, you really want to check upstream to see where's the cause, where's the interference, and how can we normalize that. Obviously, if it is some kind of thoracic outlet, we'll also teach our patients different stretches and things, some soft tissue techniques, massages, to help decrease any interference when it comes to the periphery as well. So that's a little bit about numbness, tingling. Again, you gotta always ask the right questions. So the first question is, why is this happening? What's the cause? Once you identify the cause, you can find out the solution. Thanks a lot. Have a good day.